Common narrative of conservatives and those who want to privatize our healthcare system is that when we privatize it, it'll actually increase the quality of healthcare for everybody because it's all being publicly funded. Like, it doesn't matter that they're for profit, they're still doing good for Canadians. But we don't actually have to look very far to see that that's absolute and complete bullshit. Saskatchewan has had privatized MRIs for about 10 years now, and when the program first started, they actually were able to decrease the wait time, so it looked like it was doing good. But then from 2015 to 2019, and no, it has not been fixed since then, the MRI wait time has doubled. And remember, this is one of the things that Doug Ford wants to do, but that's not even the worst of it. In Alberta, where they opened up these private surgical clinics, they are now facing a shortage of anesthesiologists. Because unlike doctors who will still be required to work in hospitals, the anesthesiologists and nurses who can then choose to go work for these private clinics don't have to work in hospitals, which could lead to a shortage of the system, and we are already facing a staffing crisis. Pretty much for all of 2021 and 2022, Red Deer has been talking about how much of a struggle it's been, and their hospital has been on the verge of collapse. Until ultimately, it did. The only anesthesiologists that were left in the public system were essentially working 24 hours on call, nonstop, 24/7, 365 days a year, because almost all of the anesthesiologists left the public sector. Not because the private sector was paying more, but because the public sector allowed them to work a standard 9 to 5. But because of the massive backlog that we have in Canada, and specifically in Alberta, the anesthesiologists at hospitals had to work 24/7. So maybe if we considered paying these people more when they work overnight and during long shifts, like they might be, considering sticking around the public system, because once again, this isn't about the money. They aren't leaving to make more. They are leaving to have a better quality of life. But we know that Doug Ford doesn't care about the quality of life of public sector workers. And in his mind, the less of them that there are, the less negotiating power that unions have. A potential benefit that could come from these clinics, and yes, there are some benefits, do not outweigh the known negatives that will occur, because we've already seen it happen in 2 other provinces.